Hi everyone! In this video, I will do the step-by-step procedure of urinary catheterization of male and female. It is an insertion of catheter through the urethra to the bladder for installation and removing of fluids. It has 7 purposes. First, to relieve urinary retention. Second, to obtain a sterile urine specimen. Third, to measure the residual urine remaining in the bladder for voiding. Fourth, to control urinary incontinence. Fifth, to provide access for instilling medication into the bladder. Sixth, to maintain an empty bladder during surgery. And lastly, to monitor hourly urine production in seriously ill client. The first step is to check the doctor's order. Catheterization is only if with medical order. Step 2. Assist whether client is allergic to iodine or plaster. Provide 1 iodine is often used to cleanse the vulva before catheterization. Excuse me, sir. May I know if you are allergic to iodine? No? Thank you, sir. Step 3. Assemble equipment needed. Organization promotes efficient time management. Step 4 is to identify and explain the procedure to the client. This to ensure the right client and to elicit cooperation. Hi sir, good day. I am Tisha Salso, student nurse from the University of Mindanao. May I know your name, sir? Mr. Juan. May I see your ID band, sir? Thank you. Today, sir, I will do the urinary catheterization in which I will insert the catheter in your penis through the urethra to the bladder for installation or removing of fluids. Thank you, sir. The next step is to provide good light. Good lighting is necessary to locate the meatus clearly. The sixth step is to provide privacy by screening or closing the door and windows. The client has the right to be protected from being exposed to others. The next step is to replace the top sheet with bath blanket. Also, place waterproof underpad under the client. This to protect the bed linen from moisture and getting soiled. Another step, place the client in a supine position with feet apart and drape the client. Good visualization of the meatus is important. Embarrassment, chilliness, tension interferes with the introduction of catheter. The ninth step is to prepare the urine receptacle and tubing if an indwelling catheter is to be inserted. The tubing facilitates in connecting the catheter to the drainage system. Another step is to open the pack and bring it near to the perineal area. Places of the equipment near the working site increase efficiency. Also, observe aseptic technique. This protects the client from spreading of microorganisms. Next step is to squeeze the small amount of lubricant over the sterile OS places in the sterile field. Organization promotes efficient time. The next step is to wash hands and putting working gloves. Hand washing prevents the spread of microorganisms.
And also do perineal care.
The next step is to put sterile gloves. This to avoid the cross-contamination of microorganisms. Step, holding the penis with dominant hand. Disinfect the meatus twice using the cotton balls with betadine antiseptic solution. Start from the top, use circular motion stroke, then downward for each cotton balls and discard. This to cleanse the area and minimizes the risk of urinary tract infection by removing surface of pathogens. Lubricate 6 to 8 inches of the catheter tip because lubrication facilitates the insertion of the catheter and reduces trauma to the tissue. Next, hold the penis perpendicular to the body and pull up gently. Also, do not force the catheter through the urethra because the sphincter relaxes and the catheter can enter the bladder easily with the client relaxed. Also, ask the client to breathe deeply and rotate the catheter gently if slightly resistant is met.
Can you take a deep breath, sir?
Next, hold the catheter securely with your non-dominant hand with the bladder empties. Collect a specimen about 20 to 30 ml if required. Continue drainage according to hospital policy. Remove the catheter smoothly and slowly. Because catheter is only needed to drain urine present in the bladder and is not intended for continuous use. The catheter is used, introduce 5 cc or follow manufacturer secure the catheter. Gently pull the catheter until the retention balloon is snuggled against the bladder. And lastly, remove the fenestrated drape. This to create a balloon to ensure catheter retention. Also maximize continuous bladder drainage. Proper attachment prevents trauma to the urethra and meatus from tension of the tubing. Catheter to urine bag below the level of the bladder. Also, tape catheter to the lower abdominal area. This to avoid reflux of urine, prevent infection or urinary tract infection. And clean the equipment. Then make client comfortable. Label the urine specimen and send to the laboratory promptly. This to urine kept on room temperature may cause organism if present to grow and distort laboratory findings. Wash your hand because hand washing prevents the spread of microorganisms. Next is to record the time of catheterization, the amount of the urine removed, a description of the urine, the client's reaction to the procedure, and other observation. A careful record is important for documenting data after the client's care. And now, let's forward to female catheterization. Hey ma'am, how are you? I am Tricia Salso, student nurse from the University of Mindanao. May I know your name, ma'am? Mrs. De La Cruz. May I see your ID band, ma'am? Thank you, ma'am. Nice to meet you. Thank you for watching. I hope you learned from this video.